of our discussion is standard specifications that are required for hospital pharmacies. Along with qualification and academic abilities, such as certain standard specifications that are required to run the hospital pharmacy. The American Medical Association, Medical Society and College Association of College, they have given a standard specification for hospital pharmacists. That first, the hospital pharmacist must have thorough knowledge about drug-drug interaction. Second, ability to conduct pharmaceutical manufacturing. Ability to conduct and control teaching and training program. Next, ability to conduct and control. We must involve inside the research work. Ability to conduct drug control procedure. And last, that is the ability to involve inside administration as well as management of hospital pharmacy. These are several standard specifications that are required for hospital pharmacists. That is, the pharmacist must have thorough knowledge about drug action, ability to conduct pharmaceutical manufacturing procedures, ability to control teaching and training program, then ability to conduct a research work inside the hospital pharmacy, ability to control drug procedures, and ability to maintain the hospital, that is involving inside the administration as well as management. One by one we have to see thoroughly. That is, first we will see about the thorough knowledge of drug action. As hospital pharmacist, he is involved in drug formulation. He must have a thorough knowledge about the drug. That is basically, that is along with the chemistry, then physiology, pharmacology, toxicology of drug. Along with that, the route of administration of drug, then adverse drug reactions that are occurring inside the drug. Along with this, he must involve along with the medical person. He must be in contact with the medical person so that new drug investigation that must be carried out inside the hospital pharmacy. So, along with the knowledge of chemistry, pharmacology, toxicology, of administration, rather than he must coordinate with the hospital pharmacy. That's why a thorough knowledge of drug is required to the hospital pharmacist. Next is, second is ability to conduct and control pharmaceutical manufacturing inside the hospital pharmacy. Depending upon the size of hospital pharmacy, number of patients that are acquired inside the hospital, manufacturing of the drug inside the hospital that will be carried out. So as the drugs are manufactured in bulk, that is in large quantity, drugs that are manufactured inside the hospital pharmacy according to the requirement, the series of tests that should be carried out to manufacture the drug. The pharmacist must have the knowledge about how much quantity the drug that should be manufactured and what is required to manufacture the drug. That is basic knowledge about the drug. That is from where the raw material required for the manufacturing that will be obtained, that is sources of raw material, and what is the procedure for manufacturing of that particular medicament that should be carried out. All this knowledge must be held by the hospital pharmacist. During the practice inside the hospital, physician may ask the pharmacist to manufacture the medicament which is not available inside the market. At that time, the trained pharmacist must be available inside the hospital so that he can manufacture that particular medicament. The trained pharmacist having the knowledge what is the procedure for preparing that particular medicament and what is required, how the dose will be calculated, and which instruments that are required inside the hospital pharmacy. This all knowledge that must be held with the trained pharmacist that is present inside the hospital pharmacy. This is about hospital manufacturing, ability to conduct and control pharmaceutical manufacturing. Next topic. Next is third, that is ability to control and conduct teaching and training program. To run the hospital and hospital pharmacy smoothly and effectively, teaching and training program that must be carried out by a skilled person, skilled pharmacist that is present inside the hospital. He must give a lecture has been prepared. That lecture along with the demonstration, the training of the new admitted pharmacists as well as nurses that should be carried out, and all the information about the drug, how to apply the drug and how to take care of that particular patient. All the information, that is all the training that must be given in teaching and training program inside the hospital. Next is ability to conduct and control research work. Research inside the hospital. Pharmacist is involved in distribution of drug as well as manufacturing of drug. So, in research work, he is involved in the research work. He is acting as an investigator or co-investigator. Investigator means new invention is carried out by hospital pharmacist himself only, and co-investigator, that is in coordination with the physician, he is doing somewhat research work. Second, he will give advice to the physician about the drug, dosage form, calculation of the dose of drug, posology of drug, toxicology of drug, the advice that is given by hospital pharmacist to the physician. Next, he is acting as a co-investigator. To increase the therapeutic activity of drug, some changes inside the formulation of drug that is carried out. The changes such as change in SAR, structure activity relationship of a drug, that is carbon-carbon double bond, then carbon-nitrogen bond, change in position of the carbon, change in position of the nitrogen inside the structure that is carried out, that will change the activity of a drug, that will increase the therapeutic activity of drug, that is change structure activity relationship. Maybe vehicle is changed, change in vehicle. Change in vehicle of a drug that may increase or decrease solubility of drug. By changing the vehicle, the solubility of drug that has been changed, and there may be increase or decrease in therapeutic activity. The aim of pharmacist is to increase the therapeutic activity of drug by changing the vehicle, by changing the structure activity relationship, or to maintain the stability of drug that is carried out by co-investigator, that is along with physician is working as a co-investigator so as to increase the therapeutic activity of drug, and in this way he is helping to the physician inside the research. Next is drug control procedure. Ability to conduct and control drug control procedure. The job of pharmacist is to store the drug according to requirement. The manufacturing of drug that is carried out inside the hospital pharmacist, and whatsoever drugs are present inside the hospital pharmacy, when they are required by patient, that must be properly distributed to the patient. That is the drug control procedure. Along with manufacturing, storage, the pharmacist must have a thorough knowledge about how the drug is distributed to inpatient, outpatient, ambulatory patient, and an emergency patient. That is drug control procedure that must be known to the hospital pharmacist. Last, that is the pharmacist, he must involve inside the administration and management of hospital. Management of an hospital that is carried out by process of planning, organization, distribution, staffing, series of work that has been done by the hospital pharmacist to manage the hospital. Along with this management, maintenance of records of the drug that comes inside the hospital pharmacy, and whatsoever distributed drug from the hospital pharmacist, the record must be maintained inside the hospital pharmacy by hospital pharmacist. So maintenance of record, along with that, all the staffing, that is planning the work, whatsoever drug that will come from manufacturer or distributor, that must be stock must be maintained. That record of that stock, whatsoever received, that must be maintained. Whatsoever daily distributed drug record, that must be maintained. The requirement list, that is purchase order, that has been prepared by hospital pharmacist. Along with that, he is managing the hospital. Administration is also carried out. Last time I have said that he is the member of P&T committee. Whatsoever policies that are governed by pharmacy and therapeutic committee, that must be implemented inside the hospital by hospital pharmacist. That's why he is involving in both, that is administration as well as management of hospital pharmacy. These are the various standard specifications that are required to run a hospital pharmacy. Next is facilities that are required to run the hospital pharmacy. Four facilities are required, that is adequate space facility, adequate equipment facility, adequate storage facility, and adequate library facility. One by one, you see, that is first adequate space facility. Previously, we have seen that inside the hospital pharmacy, manufacturing of drug is also carried out according to the requirement of the hospital. So, sufficient space must be provided for manufacturing of drug. After manufacturing of drug, storage of drug will be carried out. Before that, after manufacturing, quality control test of that drug that will be carried out. For that, sufficient space must be available. After quality control test has been done, for storage also the space facility should be available, and for hospital pharmacy, space must be sufficient space must be available for storage as well as for manufacturing of the drug. Second is equipment, adequate equipment facility. To run the hospital smoothly, equipment that are categorized into two categories, that is administrative equipment and manufacturing equipment. In administrative equipment, to run the hospital pharmacy, that is cupboards, racks that are required, that may be of wooden, that may be of metal. Then notice boards, then locker system should be there, locker will be there, table, computer, desk, notebooks, stock register, will comes under the administrative equipment. Next is manufacturing. For manufacturing a particular dosage form, that will require particular equipment. Suppose for tablet. Manufacture a tablet. The equipment required that are starting from balance, weight balance, then granulator, mixer, then granulators, then punching machine, single punch machine, double punching machine, then coating pans, then autoclave. After coating, then packaging machine. After preparation of tablet, quality control tests are carried out. For that, hardness tester, friability tester, disintegration test apparatus, dissolution test apparatus. This is for tablet. So for various dosage form, various instrument tests that will be changes. Next is adequate storage facility. Storage of drug that will be carried out depending upon the chemical properties of drug. That is storage facility for thermolabile substances that will require somewhat cool temperature. Thermolabile substances that will be stored separately. Then some drugs, antibiotics like penicillin, that will require refrigerator temperature, cool temperature, that is from 2 to 8 degrees Celsius. Then vaccines that are required cooling temperature, that is refrigerator. So separate storage facility that should be provided for storage of thermolabile drugs and for storage of poisonous and non-poisonous drugs must be separate. Poisonous drugs must be stored. Storage for poisonous drug that must be separate from the drugs that are stored inside the store. Next is library facility. As recent knowledge about the drug that must be available inside our hospital pharmacy. So the latest literatures, magazines that will give a latest knowledge to the physician as well as pharmacist that is present inside the hospital. So the magazines, that is SIMS, NIMS, that are including the drugs. Now recently, the drugs that are present, that are incorporated inside the journals. So that journals must be available inside our library, so that the physician and pharmacist, he will study about that drug and that will be implemented in our hospital. So the books that are related to pharmacology, then toxicology, recent journals that are available inside the library, APTR journals, Pharmaceutical Association of Teachers in India, that is APTR Bulletin, rating, that is must be available inside the library, so that recent work whatsoever going on inside the medical field, the knowledge of that must be present inside the physician and pharmacist who is working inside the hospital. This is about the facilities required for hospital pharmacy to run. Next is flow of material inside the hospital pharmacy. The material that will comes inside the pharmacy, that is drugs. Drugs that are obtained from manufacturing industries directly to the hospital, or it may come from distributor. Directly, it will come from industries, that is centralized process, and when the drug that is taken from distributor by taking the requisition slip, the process is decentralized purchasing. So, from by both the way, the drug will comes inside the hospital, that is directly from industry or directly from manufacturer to the hospital, or it may come from distributor. If it will come from directly industry, it is called as centralized process, where the drug is reserved inside the hospital. After receiving the drug, the record of the drug must be maintained. After recording of the drug, quality control test of the drug that must be carried out by inside the hospital if the facility is available. Otherwise, by central laboratory that has been checked. Quality of the drug that must be checked. After quality control test has been done of that particular stock has been received, then it is kept inside the hospital pharmacy, and when they are required, they are distributed to inpatient, outpatient, ambulatory patient, and emergency patient. This is about the flow chart of material inside the hospital pharmacy. By both the way, the drugs are coming, that is directly from industry or from distributor. If it is directly coming from industry, it is called as centralized purchasing, and if it is from distributor, by using the requisition slip, the purchase of the drug that is carried out, the process is known as decentralized purchasing. After receiving the drug by both the processes, the stock that must be record of that drug must be maintained inside the hospital. After maintaining the record, quality control test of that drug that must be carried out by government laboratory or by inside the private laboratory, and then the drug that is kept inside the hospital pharmacy, and when it is required by the patient inside the hospital, it is distributed to inpatient, outpatient, ambulatory patient and to emergency patient. This is all about hospital pharmacy. Thank you.